Public health directors from Adams, Arapahoe, Boulder. If we don't reduce this stress now, the impacts on capacity will mean those who need care, whether they have COVID or something else, could see that care being reduced or even rationed, and that will cost lives.
The less people that are vaccinated, the more cases we have, and the more hospital admissions we have. It's that simple. Next slide.
As regional partners, we are issuing what I like to call a VASC or mask mandate. Either your venue or business is requiring to proof of vaccination, or you choose to be a place where only masks will be required. But either or, as a venue or a restaurant or type of operation, we are putting a mandate in place.
We need to make them. And the Metro Partnership for Health is standing up to do our part, even though we have many communities throughout the state that have.
I know it's disappointing that the decisions of some, again, mean additional restrictions on our vaccinated residents. And I certainly share in that disappointment, because I know a lot of work has gone into getting us to where we are. But this is the situation before. Wear a mask or get vaccinated.
When I talk about hospital admissions, I'm often asked, well, what's the severity of those cases? What's the mortality rate? You can see this chart here also depicts very well that mortality is going up.
Again, let me be clear. We're not here today because of what we've done in Denver and the region hasn't worked. Quite the opposite. If other communities in Colorado and around the country took the affirmative steps we have taken around vaccines, the pandemic would be under control. But we will do what needs to be done to ensure that we get through the next 45 days without having a break in our hospital capacity, a break the state and the governor have made clear could risk lives.
We are right back where we were at the beginning of the pandemic, with hospitalization admissions going up, and we have less healthcare providers now than we did at the beginning of the pandemic. So in many ways, we're in a worse spot now than we were at the beginning of the pandemic, and the only way